Hi, I'm Anna Rumbach. Thanks for clicking on speech pathology students' perceptions of a standardised patient clinic for assessment and management of voice disorders. So my team and I would like to thank the Voice Foundation for the opportunity to present this research and start with a few acknowledgements, particularly acknowledging the participants in this research and the project assistance of Julia Stokes. This project was also funded by the 2017 University of Queensland Early Career Educational Research Grant. So work integrated learning experiences for health professionals provide critical opportunities for students to apply their theoretical knowledge to practice, develop profession-specific and generic skills, and develop a sense of socialisation into their profession. It's all about successfully transitioning from the classroom to the clinic. Curriculum planners need to provide a greater range of opportunities for students to achieve pre-entry professional and generic competencies in order to assure they are work-ready clinicians at graduation. Simulation is recognised by higher education and other professional accreditation bodies as an appropriate and accessible work-integrated learning method for students to gain skills in place of traditional practice, especially where in clinical caseloads that present rarely in specialist clinics that may not be able to be accessed by a majority of students. So given the paucity of simulation research specific to voice management, the overall objective of the current research was to evaluate a voice simulated learning opportunity that was designed to assist students to prepare for clinical practice in adult voice as well as assess their competency. The study aimed to explore changes in students' perceptions of knowledge, confidence, anxiety, and clinical readiness related to assessment and management of an adult client with a voice disorder across the duration of a university semester. So a prospective repeated measures cohort design was implemented for this study. Participants were students enrolled in a mandatory course dedicated to voice, held in the first university semester, either in the second year of a 4-year Bachelor of Speech Pathology Honours program or in the first year of a 2.5-year graduate entry Master of Speech Pathology Studies program. So the teaching of the semester occurred over 13 weeks, where students underwent a series of lectures, blended learning opportunities, and 2 simulations. So blended learning activities were designed to prepare students for the voice simulation-based learning activities, which were embedded into the academic coursework. So these tutorials delivered in weeks 3 and 4 of the semester targeted students' development of practical skills in voice case history taking and perceptual voice assessment. A third standalone tutorial session run in week 11, which was also run after the completion of academic coursework, targeted development of treatment session plans and practical therapy skills. So embedded within the final weeks of the voice course, all students participated in 2 30-minute simulation-based learning activities with a simulation patient playing the role of an adult with a voice disorder. Students working in pairs completed a voice case history interview and assessment in simulation 1, and then used this information gained in simulation 1 to guide an initial treatment session with the standardized patient in simulation 2. The simulation provided students with opportunities to practice a range of clinical and professional skills, which were mapped against Speech Pathology Australia's competency-based occupational standards and the Competency Assessment in Speech Pathology Clinical Assessment Tool, or COMPASS, in order to determine the activity's relevance and suitability for student clinical learning and the assessment of competency. So the impact of the simulation-based learning activities on student perceptions of knowledge, confidence, and anxiety were measured using 3 surveys. So the surveys were administered at 3 time points throughout the university semester: pre-lectures, post-lectures but pre-simulation, and then post-simulation. The core content of the 3 questionnaires was identical and contained 1 question exploring level of comfort interacting with a person with a voice disorder, 1 question exploring anxiety surrounding assessment and treatment of a client with a voice disorder, as well as 8 questions exploring perceived level of knowledge and 13 questions exploring perceived level of confidence for a set of technical and non-technical activities. The post-simulation survey also contained additional questions regarding students' perceptions of the simulation learning experience, including 3 open-ended questions to gather qualitative data related to students' views. So 117 students were enrolled in the course, 113 consented to participate, and 72 participants completed surveys at all 3 time points. And all students at the point of enrolling in the course had previous exposure to simulation-based learning activities. So change across time was analysed using repeated measures and analysis of variance, and only participants who completed all 3 surveys were included. So post hoc analysis involved planned contrast using Bonferroni adjustment. So there was pre-lectures and post-simulation to measure extent of change from beginning to the end of the course, pre-lectures to post-lectures pre-simulation to determine learning from lectures, and then post-lectures pre-simulation to post-simulation to determine any additive value of the simulation assessment. Additional data specific to the post-simulation reports the views of the entire participant cohort, so 113 individuals. The next slides present mean ratings of students' perceptions of knowledge and confidence across time for a set of technical and non-technical activities. For knowledge, students perceive significant positive changes in knowledge across all activities across all time points. Post hoc plan contrast revealed that post-lectures, knowledge in all areas increased. Post-lectures to post-simulation, further significant gains were noted. Despite statistically significant gains being made, it's also important to note that post-lectures, the majority of students reported limited to some knowledge. Following simulation, this rose to some to very good knowledge depending on the area of voice practice. For confidence, students perceive significant positive changes in knowledge across all activities, across all time points, except when it came to writing an assessment report. Again, post hoc plan contrast revealed that post-lectures, confidence increased. Post-lectures to post-simulation, further significant gains were noted. After lectures, most students were not confident to somewhat confident, with students feeling the most prepared for case history taking. Following simulation, average scores rose significantly, with students being at least somewhat confident in all areas of assessment and intervention and confident with case history taking. When asked specifically about comfort interacting with people with voice disorders, students reported neutral feelings at all stages of the academic and clinical program. However, a statistically significant increase was noted from the beginning to the end of the program, with a mean rating of 3.92 moving closer to comfortable. Anxiety related to the management of a client with a voice disorder fluctuated significantly throughout the program. Anxiety rose significantly prior to the simulation, so they went from slightly anxious to moderately anxious, then with a significant reduction in anxiety and return close to pre-course anxiety levels following completion of the simulation learning activity. At the completion of the simulation learning experience, students provided many positive comments about the clinical learning activity and method of assessment of competency. The majority of students agreed or strongly agreed that the simulation experience had helped to develop their clinical skills, apply content taught in lectures, enhance confidence and interest, and was overall a useful learning experience. Students also indicated through open-ended response questions that the main benefits of simulation activities were learning through feedback, whether this be from peers, their clinical educator, or the standardised patient. They enjoyed the safe environment and also the ability to translate theory into practice. Overall, students' perceptions of the simulation-based learning activities for voice assessment and management were overwhelmingly positive. Simulation was perceived as a valuable learning experience that should remain in the academic curriculum. The positive feedback received regarding the use of simulation in the clinical training of student speech pathologists is consistent within the literature and may be due to the inherent nature of simulation allowing for a safe, controlled learning environment where students are able to make, recognise and amend errors made in patient care without adverse outcomes for the patient. Engagement in and provision of timely feedback from peers, clinical educators, and simulated patients were also likely contributors to the high level of student satisfaction with the experience, supporting the value of this learning model. Thank you very much for your attention. If you have any questions, queries, comments, or feedback, please feel free to send me an email. Thank you.